I love that message. Good afternoon and welcome to this joint briefing for the Senate Education, Health and Environmental Affairs Committee and the House Health and Government Operations Committee. We're also joined today by members of the Joint Committee on Cybersecurity Information, Technology and Biotechnology, as well as by members of the Health and Human Services Subcommittee of the House Appropriations Committee. This is a virtual committee briefing, so I ask for your patience if we encounter any technical or streaming issues. This briefing is being streamed on the Maryland General Assembly YouTube channel. Members will be muted throughout this briefing. If you have a question after the presentation, please use the raise hand function, which is located either underneath the participant list on the right side of your screen or under the reactions bar at the bottom of your screen. I'll call on delegates and Senator Pinsky will call on senators to ask questions after we call your name. Please wait a moment while Richard unmutes your screen. Remember, even though we're meeting on Zoom, please adhere to our usual committee rules of one question and one answer from the panel, not one question and one answer from each individual panelist. Also, please keep your questions shorter than the expected answer. Today, the Senate Education, Health and Environmental Affairs and House Health and Government Operations Committee will be briefed on COVID vaccine spoilage issues by the Maryland Department of Health, followed by a Q&A session. Next, we'll hear from the Department of Information Technology on the cybersecurity hack of MDH, followed by a question and answer session. I will then turn the meeting over to Chairman Pinsky, who will lead the portion of the briefing where we will hear from the Maryland Department of Health on the impact of the cybersecurity hack on MDH. This presentation will also be followed by a question and answer session. We're going to try to keep the first portion to half an hour, the second portion to an hour, and the third portion to an hour. I think I have that straight, but feel free to correct me. We had previously given notice on the online meeting notice that an agenda for this meeting, that a portion of this briefing may be held in closed session to allow the departments give full and complete answers, which might reveal sensitive security information. I have been told by the departments that they will not provide any answers to us that will reveal this type of information. So I now do not expect any portion of this meeting to be held in closed session at their response. Please keep in mind this briefing is scheduled to conclude by 3:30 p.m. We will begin with Secretary Dennis Schrader and Deputy Secretary Jinling Chan from MDH on the vaccine spoilage issue. Please begin your presentation.
Thank you, Chairs Pinsky and Pendergrass and committee members. Good afternoon. I appreciate the opportunity to provide you an update on the matter surrounding one of our former mobile vaccine vendors, TrueCare 24. MDH Deputy Secretary Dr. Jinling Chan has joined me. We're both available to answer questions when I conclude my short remarks. First and foremost, as we've said, MDH takes this issue very seriously. The effectiveness of vaccines and patient safety are of utmost importance. As we transitioned away from mass vaccination sites last summer, MDH contracted with 3 vaccine vendors to further expand access to vaccinate eligible Marylanders. One of them, TrueCare 24, did not perform as they indicated they could in their proposal to provide COVID-19 vaccine services to the state. When MDH became aware of TrueCare's initial operational and clinical issues in the beginning of July 2021, we required them to put in place a remediation plan before they started vaccinating individuals at the end of July. Unfortunately, during August, despite having a detailed remediation plan with corrective measures and a notice to cure their defects, TrueCare was unable to properly address their issues. Therefore, on September 8th, MDH terminated TrueCare's Immunet account and stopped giving them further vaccine assignments, primarily because they were unable to follow the comprehensive and stringent CDC vaccine guidelines. On September 24th, MDH referred this matter to the department's internal controls and Audit compliance team to conduct a full investigation. MDH reached out to the 3 vaccine manufacturers, Moderna, Johnson & Johnson, and Pfizer, for guidance on October 1st. MDH then contacted CDC for guidance on November 10th, and they advised us to notify the affected individuals on November 22nd. On December 30th, we began contacting those impacted by this and now have reached them all. Again, as I said last Wednesday during a vaccine oversight work group meeting, I'm not happy about how long it took MDH to determine clinical next steps and to reach out to impacted individuals. I have directed the audit team to complete their review into this and have it on my desk no later than the end of this month. I'm committed to taking any internal corrective actions dictated by the results of the review. Regarding notifying individuals who have been affected, last month MDH put in place a plan to contact every individual impacted by this and offer them a supplemental vaccine dose as recommended by the CDC. There are 873 individuals in total based on our latest records analysis, and MDH began to outreach to these individuals on September 30th by sending a letter and email, including in English and Spanish, to those who provided email addresses. In addition, MDH made follow-up phone calls and sent text messages to those who provided phone numbers. Again, we have now reached them all. The purpose of the outreach is to inform each individual of the incident, which is detailed in the letter and the email, and out of an abundance of caution, offer them a supplemental vaccine dose, which is what the CDC recommends, and MDH explains during the follow-up phone call and text messages. When MDH speaks with someone on the phone, the individuals are given the opportunity to schedule an appointment for their supplemental dose. If anyone has a question, they are referred to a member of the MDH clinical team to help answer their questions. MDH is now in the process of scheduling supplemental vaccinations. Some of these individuals, about 135, are incarcerated, and MDH has been working with the Department of Public Safety to ensure they are informed of the issues and offered a supplemental vaccine dose. In coordination with the Department of Public Safety, MDH has scheduled 4 vaccine clinics. 3 will take place today and 1 tomorrow. Before I conclude, I want to update you on a clinical escalation process now in place. I took this step to prevent another incident like this or any other critical clinical safety issue happening again anywhere in our COVID-19 recovery program. Moving forward, the head of the clinical advisory team is now empowered to bring any clinical safety issue to the attention of Dr. Chan, the director of the recovery team, and myself, if need be, immediately. In addition, I've directed Dr. Chan to do a top-to-bottom review of all of our mobile vaccine operations. Thank you. And Dr. Chan and I are now available for your questions.
Thank you, Mr. Secretary. I am looking and I see that Delegate Resnick has a question.
Thank you, Madam Chair. I didn't realize I jumped in first, but here I am. So, Mr. Secretary, thank you for that presentation. I appreciate what you all have done. Before I ask my question, I do want to point out, I think it's, and to the members of the committees on the call, I just want to vocalize my personal feelings that I think it's highly inappropriate that while we are having this briefing about spoiled vaccines, which the public needs to be aware of and the press needs to cover, that the governor is currently holding a press conference on COVID-19 at this very moment. I think he could have waited an hour. That being said, I'd like to move on to my question. You've given us a lot of information about what you have done since news of this incident has broken. In Montgomery County, we had a slightly similar incident where 98 children were given inappropriate doses, not spoiled doses, just poorly mixed doses. And within 7 days, the County Department of Health contacted the vaccine providers, contacted the CDC, and gotten guidance. And within 7 days, we're able to start contacting families to schedule new doses. They were eviscerated by the public because it took a week. So what I would like to know, I have 2 questions. One, how is it that you waited for months before the public was informed? And second, how is it that only now are you putting protocols in place to monitor the private contractors that are doing the vaccine clinics and not have this as part of the original contract that you'd had with them? Thank you.
Thank you, Delegate. Let me start, and then I'm going to turn it over to Dr. Chan. The fact is, we were monitoring the contractors at the time that this started back in the summer. And we discovered this through our contract monitoring process. What we were slow at, and we quickly took the contractor that we were not satisfied with out of the Immunet system. What we were slow at was getting the advice from the manufacturers and the CDC, and that should have been much faster. So Dr. Chan, and Dr. Chan is in her role also oversees the Center for Immunization. So Dr. Chan.
Thank you, Secretary, and thank you, Delegate, and members of the committees. So yes, the clinical oversight and monitoring has existed from the beginning with these contracts, and so that is indeed how the issues were first identified. However, in this particular instance that the Secretary just outlined, the issue was documentation, and so we were in our teams piecing the information together to identify which clinics and which individuals, and so that took some time. And so then when we had the information together, we consulted with the manufacturers as well as with CDC.
Okay, if that's completed, let's go to Senator Ellis, please. Unmute him, please.
Okay, I just unmuted myself. Thank you, Mr. Chairman and Secretary Schrader. So I have a question as far as any potential side effects or bad outcomes for the patients who were given a bad dose of a vaccine. What are the potential negative effects on them personally? What type of follow-up is the health department doing with these people to see if there are any negative outcomes from these individuals, especially those who I think I heard you correctly, those who were incarcerated who were given these vaccines?
Thank you, Senator. Let me start with an answer, and then, or actually, no, I think the rules are that we only do one answer from each question. So I will defer to my colleague, Dr. Chan.
Thank you so much, Secretary and Delegate. So I guess I would reiterate the fact that, when we reviewed the situation, what came to light was that the issue at hand is that there was poor documentation of the temperature logs at which the vaccines were held. The provider did a number of mobile vaccination clinics around the state, as you know, and as our team looked at their logs and information, there are clinics that the documentation was appropriate, and both we and the manufacturer and CDC felt confident that those vaccines were held at the appropriate temperature. So in the other instances, for the 873 individuals affected, those clinics did not have the complete documentation to show that the vaccines had been held at the appropriate temperature. It doesn't mean that they were not, it's simply that the documentation was not there. And so those, because of that, the CDC actually considers those instances an example of a vaccine administration error, and so that is why, out of an abundance of caution, they made the recommendation that we offer these individuals an additional dose. However, it's erroneous to say that these are spoiled vaccines collectively, because really the issue is not so much that we know that they were spoiled, it's that there is no documentation. So we are uncertain about whether the vaccines were held at the appropriate temperature. However, that being said, your question being whether or not those vaccines have the potential to cause harm, and we do not believe that that would be the case given the circumstances that we have been looking into. So, however, this is, again, I would emphasize, out of an abundance of caution, we're recommending, based on CDC guidance, an additional dose.
I'm going to say thank you. That was a very complete answer, which gave us a better picture. I will do a little follow-up to ask why it is that we're not doing some kind of, I'm trying to think of the word, I'm going to use the word immunity, but it's the wrong word, checking for immunity in the blood to make sure whether they do or don't need an extra vaccine, because I think the concern was giving people too many vaccines too close together might be a problem too.
Thank you, Madam Chair. Thank you, Madam Chair. This is something that we did ask the CDC as well about, whether or not an antibody test, for example, might be warranted in this case. And as of this time, the CDC has not recommended that antibody tests be used to ascertain immunity, and so we did not make that recommendation. However, because as you are aware, with the 2-dose vaccines, the mRNA vaccines, there's already a recommendation for a 3rd dose booster for those 5 months after they finish their first 2 series. And so they have been studying extensively 3rd doses, and in some cases may perhaps, and this is speculative, other doses and what the potential impact might be. And so far they have not seen any additional adverse effects beyond what may have already been identified and mentioned that we're observing.
Thank you. I'm going to turn to Delegate Bagnall next. We're going to be alternating with the senators, just for your information.
Thank you, Madam Chair, and thank you for this presentation. I will say that the timeline that you laid out is confusing, so it would have been beneficial to have something in writing so that we could sort of follow along as you were laying out the timeline for us. But given that many of the recipients of the mobile clinics were vaccinated as a matter of convenience, and the recipients were, so they weren't necessarily local to the location where the clinics were set up. Can you lay out what the clinics that you set up? You mentioned that there were 3 today, 1 tomorrow. How you're ensuring that they're convenient and accessible to the people who need them? And given that there was a documentation issue, why are we not doing a public information PSA proactively? If you have questions about your vaccine, if you were vaccinated at this location between this date and this date, contact the health department for more information. Thank you.
I'll go ahead and take that one, yeah. Thank you, Delegate. So the way we set this up, the clinics I mentioned were specifically for Department of Public Safety population. That was about 135 people. All of the other individuals who we have contacted, we are calling them through our call center, and they have access to the appointments all over the state. And so therefore, we are taking them, if they say, I would like another vaccine, we work with them online to get them to the closest, most convenient opportunity for another vaccine near their place of business or where they live. And so we're doing that as a one-on-one opportunity.
Thank you, Madam Chair.
Madam Chair, why don't you call on one other House member, then I'll call on Senator Lamb, and then you can call on the final two House members, and maybe that'll conclude this section. You're muted.
Thank you. Delegate Hill is next.
Thank you very much. Thank you, Mr. Secretary. And Dr. Chan, I am a little confused. No, I'm very confused. So the analogy is that if my condom breaks, I'm not going to wait and see what happens before I start taking precautions. So you were notified by Jessica Ray in July that there were issues with the vaccines and she had recommended some actions. You could have called the CDC then. You certainly could have said to the 135 folks, we're not sure whether the vaccine you got is effective or not. So to the chairman's point, you could have then said, we're going to follow you. We're going to test your antibodies in a couple of weeks. And if they're not up, particularly since you live in a congregate living facility, which puts you at higher risk, then we may have to give you another vaccine, but we're going to check. So I'm really confused about the 2-month delay in notifying them that they may not have been effectively vaccinated, and why you needed CDC's permission or their advice before you acted. And it took 2 months to get it.
So thank you, Delegate Hill, for your question. When the issues were initially raised, we were working very closely with the contractor to resolve those issues, and this is where the contract monitoring process began. When our team at the Center for Immunizations became involved, they looked at, and this is what they would be doing regardless of who the provider may have been, looking at the documentation, because what we didn't want to do is provide advice perhaps based on no information or wrong information. So we need to look at the data and look at the information that was provided by the provider. And so there was some challenges with that documentation, as I have mentioned before, and we recognize, as the Secretary said, that there was a delay in that, and so this is why we have increased the there's an escalation protocol now that that adds to the existing process that was already in place. And so the contact with the CDC, with the manufacturers, what we were able to identify were that there were a number of clinics in which the documentation was appropriate and that the manufacturers would support it. So those individuals did not have to be contacted. So that is fortunate. And so those are not part of the group that we're contacting now.
Okay, let's go to Senator Lamb. Please unmute.
Sure. Thank you, Mr. Chairman. So I raised this concern last week when we had the Vaccine Oversight Work Group hearing. And my concern is that this is really just the tip of the iceberg, that in speaking with the whistleblower, that it has become clear that there was not much quality control or quality assurance done with regards to these vendors as they were administering the vaccines, that there was really a blind drive to pump up the numbers. The only metric that mattered at MDH was the number of arms jabbed, regardless of how the quality and handling was with these vaccines. Having proper documentation is pretty basic. It's handling 101. For anyone that's handling vaccines, they need to know the temperature, they need to have a temperature log and some assurance there. It's similar to buying a car where you need to have a clean title in a car. If a salesperson can't produce a clean title, sounds like red flags to me. I'm not sure why you're downplaying the fact that there's improper documentation of the handling of these vaccines. To say that these vaccines aren't spoiled, we just don't know if they're spoiled or not because there's not proper documentation, doesn't seem to be the proper approach to take to addressing and remedying the situation. And so I'm not convinced that not having proper documentation doesn't mean that they weren't spoiled. And I think your assumption that they weren't spoiled just because they didn't have proper documentation is improper. Have you fully reviewed all of the records of the vendors to see if they have proper documentation on handling of all of their vaccines? Can you assure us that all of the other vendors have full and complete handling documentation, including temperature, that's up to date and is reproducible upon request? Can you assure us?
So Senator Lamb, thank you so much for that comment. And so, please don't misinterpret my comment as saying that, that this is not important to us. That's clearly not the case. We are before you. This is of concern to you as a physician, myself as well. Vaccine safety has always been our top priority. And so, we took the actions and early on, even with TrueCare in particular, took steps to mitigate and limit their impact as we learned more about the challenges that in their operations. And so, as we're doing this, continue to do mobile vaccinations, our clinical team continues to provide oversight. They are on site with the vendors and providing that clinical monitoring, and any issues that they identify are raised. And, we are undertaking a safety check now again to ensure that exactly what you're asking about is in place.
Okay, sounds like it hasn't been done yet, but back to you, Chairman.
Our last two questions on this will be from Delegate Valentino, followed by Delegate Rosenberg. And in the next round, I'm going to suggest that Senator Pinsky call on senators first and then turn it over to me, and I'll call on delegates, and that way we won't be going back and forth. So with that, go ahead.
Thank you, Madam Chair. And I fully appreciate that the immediacy is to work on mitigating the damages and getting the appropriate assurances that people were adequately vaccinated. But I do feel compelled to ask the department what, I've also seen when we have the Optum hearings and everything, and when I'm on joint audits, there was a contract with a vendor, there were general funds expended. Are there going to be, or will there be, I know you're primarily focused on getting the vaccines out, a damages portion for the state to go back now and collect damages for breaches of the contract that they should have had to be monitoring and keeping what, as Senator Lamb said, is reasonable documentation? Because I am concerned that vendors are getting the appearance in Maryland that they can contract with the department and be in breach, that compliance isn't really a requirement, or non-compliance isn't really something they should be concerned about.
Delegate, let me handle that question. Thank you for that. Right now, we have our audit team reviewing this situation, and I expect at the end of the month, they will be making recommendations on what to do to mitigate. Secondly, this contractor was, as soon as we realized that they weren't going to be able to perform, they were cut off and were not given any assignments. So it's not like they were working and earning money or being paid. They were cut off. And that happened within, from the time we realized there might be a problem, we gave them a cure notice, which is required by the contract. They had an opportunity to remedy. When they didn't remedy, we immediately cut off their access to Immunet. Now, we also reserve all our legal remedies as part of our review. And by the end of the month, when the audit team gives me their recommendations, we'll know what their recommendations are and follow them from there.
Thank you, Madam Chair. I hope that they will keep us briefed on the amount of damages that are expected to be received and the timeline for that. Thank you, Madam Chair.
Go ahead, Delegate.
Thank you, Madam Chair. Mr. Secretary, just referenced the audit report by your internal auditors. I have two questions related to that. One, will you be making the full report from your auditors public and available to the legislature promptly upon your receipt of it? And is there any participation in this audit by your Inspector General or by the General Assembly's Office of Legislative Auditors?
Yeah, thank you, Delegate. My recommendation would be, and we work very closely with DLS and OLA, that we share this with OLA so that they have visibility. I think that would be very appropriate. Of course, we want to, I have to read it and understand it before we just hand it. So I wouldn't be doing that immediately once it hit my desk. I want to digest it a little bit with my team. And then in terms of the IG was notified of this and determined that it was more appropriate for our audit team to handle rather than the IG.
Thank you.
Okay, thank you for that presentation. It, I believe, was helpful, and the questions were also very helpful. Before we turn to State Chief Information Security Officer Chip Stewart and Deputy Secretary Lance Shine from the Department of Information Technology to hear about the cybersecurity hack on MDH, I want to thank my son, Aaron Pendergrass, Chief Scientist of the Cyber Operations Branch at the Applied Physics Lab, who developed questions that were supplied to the administration last week by me to give us a professional framework to organize this technical portion of the briefing. We're fortunate in Maryland to be able to rely on individuals like him who contribute their time and expertise to help us do a better job for our citizens. Now, whichever of you would like to start with that framework in mind, please go ahead. Chip Stewart, are you there? Deputy Secretary Lance Shine, are you there?
Yes, Chip Stewart's here. Lance Shine is here.
Great. Thank you for being here today. I'm a little disappointed that we didn't get answers to our questions in writing and didn't get told till today that we weren't getting answers to our questions. Would you like to start there, please?
I'm sorry, start with what?
The questions that I sent to you to answer, to organize this briefing.
Okay, much of that will be included on our remarks, so if it's okay, we'll just start with our remarks.
Okay, it would be appreciated if when you get advance notice of a week to answer something that you might reply back before the time of the hearing to let us know that you won't be replying to that you will be doing this at the hearing, but you won't be sending us the answers in writing. Could you do that in future, please?
Absolutely.
Thank you.
All right, good afternoon. Thank you, Chair Pendergrass, and thank you, Chair Pinsky. My name is Chip Stewart, Chief Information Security Officer for the state of Maryland, a position I've held since 2019. Before that, I worked with the state as a contractor supporting the Department of Information Technology and the Department of Budget Management when that agency oversaw the Network Maryland program. My involvement supporting the state goes back to 2004, so that support with technology and security initiatives. As you're aware, the Maryland Department of Health experienced a service disruption on December 4th as a result of a network security incident. While that investigation is ongoing and is occurring on a parallel track to our restoration efforts, we can confirm this much today. This was in fact a ransomware attack. We have paid no extortion demand, and my recommendation, after consulting with our vendors and law enforcement partners, is that we do not pay any such demand. It would be premature and potentially damaging to the investigation and to the security of our systems to disclose additional details. At this time, we also cannot speak to the motive or motives of the threat actor. Both law enforcement and cybersecurity authorities have observed that health and hospital systems are increasingly being targeted by malicious actors, even more so during the pandemic. Again, we're still very much in the midst of an active investigation, so we're limited in the information that we can share. And I thank you for recognizing that and appreciating that. We've evaluated the risk related to sharing additional details with you and the public today, and that is formed kind of the basis for what we're going to share. We feel like it represents a good balance between transparency and protecting the integrity of the investigation. I also want to be clear that I'm not going to be able to speak to the specific tools and capabilities of the Maryland Department of Health's IT and cybersecurity teams, for the obvious reason that we can't disclose such sensitive information that could be used to harm the network or the citizens of the state. I also wanted to address the offer to hold an executive session to discuss this incident further. I'm aware this was covered in your opening remarks, but we have been informed by our internal counsel that in this case, an executive session wouldn't provide the ongoing confidentiality needed to protect the sensitive information about the investigation and our IT security systems. As cybersecurity threats are ever present, we have a duty to Marylanders to protect information that could be used by threat actors to target the state in the future. I can, however, speak in some depth about the incident response and detection, including how the MDH IT and cybersecurity teams first identified the attack, how our incident response team kicked into gear, and the ongoing restoration efforts. During the early morning hours of Saturday, December 4th, Maryland Department of Health's network team identified a server that was not working properly. The network team immediately launched an investigation to determine the cause of the technical issues. Through routine troubleshooting, they identified activities that they felt warranted escalation to the MDH IT security team. Shortly after that, the MDH network team and cybersecurity teams alerted the MDH Chief Information Security Officer that they suspected a ransomware attack. I was notified shortly thereafter and activated the state cybersecurity incident response plan through the Maryland Security Operations Center. This action immediately triggered notification to the state cyber response team, which includes the Maryland State Police, the Maryland Department of Information Technology, the Maryland Department of Emergency Management, the Maryland National Guard, and the Governor's Office of Homeland Security. Additionally, I notified both the Federal Bureau of Investigation of the incident, as well as the U.S. Department of Homeland Security, Cybersecurity and Infrastructure Security Agency. You've probably heard them referred to as CISA. These notifications are part of our standard response and playbook for cybersecurity incidents. Additionally, I activated the state cybersecurity insurance policy through the state treasurer's office, bringing external forensic resources and advisory resources to help ensure that we're handling the incident in the best way possible. The companies and personnel provided by the insurance policy are widely regarded as the best in the industry, and we very much appreciate the ability to involve them through the treasurer's insurance policy. These actions brought together all the resources needed to facilitate a comprehensive investigation and a secure recovery. At my direction, and in accordance with our incident response playbook, MDH took immediate containment action by isolating their sites on the network from one another, external parties, the internet, and other state networks. As a result of this containment approach, some services were rendered unavailable, the data updates to the COVID dashboard being the most visible. Again, I want to be clear, this was our decision and a very deliberate one. It was the cautious and responsible thing to do for threat isolation and mitigation. Again, this was a ransomware attack perpetrated by a criminal on the Maryland Department of Health systems. So ransomware is a type of malware that prevents authorized users from accessing data and systems until an extortion payment is made. Some cyber criminals also use what is referred to as a triple threat, consisting of malware, data theft, and denial of service attacks as part of their extortion ploy. While an unsuccessful distributed denial of service attack did follow the ransomware event, we have no evidence to suggest that it originated with the same adversary. In addition, we have not identified, to this point in our ongoing investigation, any evidence of unauthorized access to or acquisition of data. As many of you know, and as the Cybersecurity and Infrastructure Security Agency, FBI, and Department of Health and Human Services have all indicated, cybercriminals are actively targeting healthcare and public sector health entities. Furthermore, cybercriminals have taken advantage of the pandemic crisis, and as one report by the cloud security firm BitGlass noted, cyber attacks against U.S. healthcare entities rose by over 55% in 2020 compared with the previous year. And these attacks are also increased in sophistication and scale. Unlike many organizations which take days or weeks to contain security incidents, Maryland Department of Health isolated and contained its systems within several hours of first detecting the incident. We're continuing our thorough forensic investigation, and I'll reiterate, at this point, there is no evidence that this incident resulted in unauthorized access to or acquisition of any data. We understand this incident and the outages that followed have caused frustration and inconvenience for many Marylanders. Since the discovery of this attack, our teams and partners have been working tirelessly and continuously to contain and investigate the incident, as well as safely restore full functionality to MDH's network systems. In cybersecurity incidents, there can be pressure to reconstitute services quickly, sometimes too quickly. All too common are stories of organizations that had to restart recovery efforts because of this, sometimes once or twice because of that misstep. While this may seem like a slow-moving process, we're recovering with deliberate action to minimize the likelihood of reinfection. Again, I cannot stress how important this point is. In order to protect the state's network and the citizens of the state of Maryland, we are proceeding carefully, methodically, and as expeditiously as possible to restore data and services. In addition, the state of Maryland will continue adapting and hardening our IT systems, infrastructure, and defenses in order to help protect the information that is in our care. We take this responsibility very seriously. With that, I will turn it over to Deputy Secretary Lance Shine to discuss system restoration.
Thank you, Chip. Good afternoon, Chairman Pendergrass and Chairman Pensky and committee members. My name is Lance Shine, and I'm the Deputy Secretary of the Maryland Department of Information Technology, known as DOIT, as well as the state CTO. I have been in this position since February 2017, and prior to that, I served as the Chief Technology Officer for the Maryland Department of Human Services. I was the Deputy Chief Technology Officer for Washington, D.C., and the Chief Information Officer for the Washington, D.C. Department of Transportation. From the moment this incident was detected, our actions have been guided by the principle of protecting the systems and data in our care, as well as the health and safety of Marylanders. Throughout this process, we have prioritized restoring health and safety functions and have made good progress on bringing systems back online as safely and quickly as possible. As Chip indicated, MDH, together with DOIT and a network of internal and external partners, has been working around the clock to contain and isolate the threat and safely restore system functionality and delivery of services, many of which have already been restored. Fortunately, because of the state's aggressive cybersecurity strategy and the use of cloud services like MD Think, the incident did not affect many of the department's core functions. And for those of you who do not know what MD Think is, it's Maryland's Total Human Services Integrated Network. The state has spent over $400 million on this network. It's an innovative cloud-based platform that allows multiple health and human services state agencies to share and manage data in one encrypted system. This integrated platform gives us the opportunity to provide citizens with more comprehensive and coordinated assistance across our agencies in order to achieve Maryland's citizen-centric vision. While being clear not to minimize this attack, we also know this could have been much worse. In fact, many of MDH's core functions were unaffected, including Medicaid eligibility and enrollment, COVID vaccination and hospitalization figures, and additional core department functions. With respect to impacted functions and COVID-19 data and services, MDH resumed reporting COVID-19 vaccination and hospitalization data on December 7th and 8th, respectively. Top-line COVID-19 surveillance reporting suspended temporarily began again on December 20th, and MDH resumed reporting for COVID-19 confirmed and probable deaths by jurisdiction on December 28th. The COVID data that you see on the website is a result of a lot of complicated processes, systems, and data that comes together. When the incident occurred and we took the system down, we needed to identify the safest way to make the COVID data available as quickly as we could, all while making sure the systems were secure and could continue to be investigated. In order to ensure that the data being used to make critical decisions was accurate, secure, and trustworthy, we needed to be very deliberate in validating all processes involved in making the data available and could not rush to release this information until we were certain it was ready. This was not a process where we could make some phone calls to manually collect data. We have 400 to 500 major lab components that submit results regularly. Positive tests are processed to flag unique new cases, deduplicating individuals who may have taken several tests. And the test volume exceeded 1 million just in the 2-week period after the incident. Additionally, MDH restored the ability of Maryland's electronic vital records registration system to issue death certificates on December 18th, and MDH restored the electronic data interchange transaction processing system connectivity on December 15th, which enabled the resumption of payments to our Medicare provider, or to our Medicaid providers. Again, the incident investigation and response are ongoing and involve multiple agencies and partners, including state and federal law enforcement, with respect to criminal liability. I'll now hand it over to Deputy Secretary Atif Chandri to talk more about business continuity.
Great. Thank you, Lance. My name is Atif Chaudhry. I am the MDH Deputy Secretary of Operations. I'm here today to discuss MDH's efforts that are ensuring business and service continuity in the aftermath of this attack. MDH and DO-IT are working closely to address this incident and have implemented the FEMA Incident Command System, or ICS, which provides a flexible mechanism for coordinated and collaborative incident management that includes the sharing of resources. Under this ICS system, we have formed a unified command structure to address this incident, which permits both MDH and DO-IT to jointly collaborate to manage and address all matters. DO-IT provides the technical expertise and is taking the lead on security and IT system recovery efforts. MDH is focusing on business continuity and ensuring the department is able to continue to provide services that are in line with our mission to promote and improve the health and safety of all Marylanders. MDH business units have existing continuity of operations plans, also known as COOP plans, which provide a methodology and plan for programs to continue performing essential functions in the event of an emergency or interruption of services such as this attack. MDH's COOP plans were initiated and implemented in the hours immediately after the incident was first detected on Saturday, December the 4th. It is important to note that all these COOP plans have been implemented, executed, and modified accordingly when necessary. Any effective COOP plan and recovery effort cannot be static. It must be adjusted to meet the particulars of the incident you're facing. Immediately following the attack and in accordance with the department's COOP plan, MDH started assessing the business functions that were impacted and began to prioritize them. In this instance, we are using a tiered system that is focused on mission-critical and life safety business functions. This prioritization of the department's affected functions has led to the development of a critical path for recovery and bringing systems back online. MDH also immediately began implementing modified workflows and business processes across the department in order to continue to provide services in accordance with existing and modified COOP plans, again, focusing on our most mission-critical operations and life-saving services. These solutions include Maryland's previous and prescient decision to migrate to Google Workspaces. This has permitted access to a full suite of online tools unaffected by the incident and allows MDH to continue to collaborate and save and share critical files. MDH is continually reviewing business functions and processes and is working to implement modified workflows to ensure continued operations and functionality for the department. MDH also set up hoteling space for MDH employees to be able to do their work on clean equipment and in a clean, safe environment. We have also ordered additional equipment to implement the department's COOP plans and modified business processes. This includes ordering 2,400 laptops with an additional 3,000 ordered this week. Additionally, MDH also ordered MiFi devices, printers, wireless access points to ensure employees have the equipment to do their jobs and continue to provide services to the citizens of Maryland. Without a doubt, one of the department's mission-critical functions is the state's ongoing COVID-19 response. And on that aspect, we have remained fully operational throughout this incident. MDH also ensured the department's healthcare system has remained operational throughout this incident while maintaining standards of care. We are also working with cybersecurity and system specialists to support our efforts, and these independent teams have been working alongside us since the earliest days of the response. I want to thank you for your time today and look forward to answering any questions you may have. I will now turn it over to Secretary Schrader. Thank you.
Thank you, Atif. I also want to acknowledge the tremendous work that Chip Stewart and Lance Shine have done, and the DO-IT and MDH assessment and business operations restorations teams that have been active since early December. Their teams have been working incredibly hard on behalf of Marylanders to assess our processes and get them back online, working throughout the holiday, and we all owe them a debt of gratitude. And now that you have a better understanding of the details of the attack, I want to briefly discuss the evolution of the department's information technology capabilities over the past 6 years. Before I do, however, I'm sure that you share my outrage that this act was an attack on all Marylanders in the middle of a pandemic. If we had not made the investments that we had during the past 6 years, this direct hit could have been much worse. Let me start by saying in 2016, the MDH information technology and security lines of authority were blurry, many protective measures were not in place, and who was in charge was not clear. The IT world is dynamic and new threats emerge constantly that quickly render yesterday's security measures obsolete. Suffice it to say, MDH was well overdue for an IT evolution. This was a major challenge that we deliberately set out to address in 2016, and we have been in a race against time for 6 years. In 2016, we estimated that less than 35% of the department's actual technology fell under the department's chief technology officer. Each of MDH's business units had their own independent IT operations, and because of this lack of more centralized IT oversight process, the department had nothing in the major IT development project pipeline, and there was no modern disaster recovery site. Since then, we have invested $229 million in projects since 2016. In 2017, it was clear that this centralized leadership and accountability was needed, and a critical first step in this direction was the hiring of the department's first chief information officer, who was empowered to lead all technology operations and development for the department. In addition, we developed a more direct relationship with the Chesapeake Regional Information System for our patients, also known as CRISP, the state's health information exchange, that has enabled us to build a major public health tool that has become invaluable during the pandemic. In 2018, we commenced the process to consolidate our MDH hospital and IT under the department's Office of Enterprise Technology and the new CIO. We also committed $90 million of Medicaid investments to jumpstart the MD Think program that you heard about earlier from Lance. A major project was also utilized to begin the process of consolidating data centers, as well as to establish a modern disaster recovery site. In 2018, the department also established a 10-year, $500 million Medicaid Modular Transformation Program with the Centers for Medicare and Medicaid Services. Progress continued in 2019 with MDH initiating the project to consolidate several data centers and planning for a modern disaster recovery site. We also began to move the Vital Statistics Administration birth and death records to the MD-Think platform. Birth records were successfully transitioned, and death records, fortunately, were completed in December 2021 as this attack unfolded. In addition, we also mitigated long-term care Medicaid eligibility and enrollment and the Maryland Health Benefit Exchange to MD-Think. In 2020, MDH hired its own Chief Information Security Officer, as well as a Medicaid Enterprise Systems Director, and we further deepened our ties with the Department of IT through a memorandum of understanding, which included conducting a cybersecurity survey project. With the onset of COVID in 2020, the department began preparing to collect and tabulate COVID, vaccination, and other data, which the Department of IT and CRISP heavily supported. During this past year, in 2021, we completed the consolidation of data centers at TierPoint, which is a do-it site that has cloud-based capabilities, and shut down our data center at 201 West Preston. And we continued to migrate applications to MD-Think. We established our state-of-the-art disaster recovery site in Dallas, Texas, and created new department policies and procedures pertaining to data use, business continuity, and incident management. We also began our work to implement the Governor's July 2021 executive orders, which established a privacy and data officer for each cabinet-level department. So in conclusion, in 6 years, information security and technology at MDH has gone from a loose constellation of initiatives and responsibilities into a much more centralized, strategic, and resilient system. The cybersecurity foundation we have built and the modern system we are growing has been instrumental in helping us to absorb this attack. There remains important work to be done for sure, as the December 4th attack reminded us. Our ability to identify and mitigate this attack in a few hours, as well as the pace of the ongoing restoration effort, speaks to this evolution. I thank the committees for your time. We're now happy to take your questions.
Madam Chair, should I begin?
It's all yours, Senator.
Yeah, first of all, to the gentleman at the table, there must have been miscommunications because Chair Pendergrass at the outset of this, laid out a framework. We wanted to deal with do it first and have that presentation take questions, then move to Department of Health and the adaptability and questions to that. And for some reason, I felt like we were sitting through a filibuster. So I'm a little upset that what Chairman Pendergrass recommended was ignored. That being said, there's some fundamental questions that have to be addressed. So I'm going to take a little latitude, Madam Chair, before I start on senators. The first question I have for Mr. Stewart and Mr. Shine: when did you realize that the system had been breached and that your data was captured? It's a simple question.
So I can answer that.
Good.
So the incident was detected on December 4th.
No, that wasn't
the date.
I didn't ask about the incident. I said, when did you realize the system had been breached and your data was captured?
Well, I think that the term data captured doesn't describe what actually happened, which is, I think, my concern. If you're saying when was it identified that this was a ransomware attack?
No. Well,
okay.
yeah, give us that answer, first of all. Yes.
Yes, so that was on December 4th in the morning, I believe somewhere around 11 a.m.
December 4th, you knew it was ransomware.
That's correct.
Great. Okay. do you recall the briefing of December 22nd, the afternoon of December 22nd, that all four of you attended virtually to the Speaker of the House and the Senate President and some staff members, myself, and I believe Senator Griffith, along with Mr. Mitchell representing the governor. Do you remember that briefing?
I do, sir.
Okay. You explained during that briefing, there was an incident, and I underline incident, and that you had removed or closed off the systems to review and protect them, as you've shared today. You said there was an attempt to enter the system and break through the defense, but that there was no penetration of the defenses. You said there was no hack. And after your presentation on the 22nd, I think I actually asked the first question, and I said, to be clear, you're saying there was no hack into the system. It was an incident. And you responded, that's correct. Do you remember that conversation?
I remember the conversation, but I believe I recall it slightly differently. I believe the language we've been very consistent with is that there's been an incident that is a technical definition of what's occurred. And to date, we have no evidence of the unauthorized access to or acquisition of data.
I guess this is where I feel like tearing what hair I have left. When you said very explicitly, unequivocally, there was no hack, you implied there was no penetration beyond the defenses. You said there was an attempt by, you explicitly said it was from an outside source and not an internal source. You did not use the word ransomware when you briefed the Senate President and the Speaker of the House. I don't know if word games were being played or it was a disingenuous presentation, but the two leading people of the Maryland legislature were misled. And I'm trying to understand why you didn't tell them there was ransomware or that it was penetrated. I mean, for an outside source to capture and control the data so you couldn't use that data, maybe, in legal terms, it's not a hack, but I think in layperson's term, that's a hack. Our system was penetrated. And you explicitly denied that in a briefing on December 22nd. So tell me what I heard wrong.
So I will apologize if this seems to be an attempt to mislead. It is certainly not that. We've kept details of what occurred very close to the chest because it's a criminal investigation, and having those details come out could impede our ability to contain and mitigate the incident.
So when on December 22nd, I believe around 2:30 or 3 o'clock, you told the Speaker of the House of the state of Maryland and the Senate President of the state of Maryland, there was no hack. You did not share that there was ransomware. You said it was simply an incident, and you did not define incident. What was your attempt to do that day? It was an attempt to mislead the legislature of the state of Maryland. Correct me, please.
I am more than happy to review with you our definitions that we went through at the very beginning of that presentation, where I laid out what an incident is.
Mr. Stewart, I've seen enough dancing. I've heard 40 minutes of dancing. And apparently I heard dancing on December 22nd. And the public should expect more of that. I mean, the question here, I don't want to question that there was an attack on our system. You couldn't have stopped that. The governor couldn't have stopped that. But the question is transparency. And the question is also integrity. And I'm not talking about system integrity. I'm talking about human integrity. The question becomes, who should we trust? And can we trust the administration and your department in telling the truth? Because until yesterday, as Delegate Resnick said, 24 hours before you're appearing before us, all of a sudden, there's a 180-degree shift. Why did that happen yesterday when we've had 6 weeks prior to that? And it's unfortunate that we don't know what to tell the public. People are asking us. And we don't know who to point to say you can trust. And unfortunately, all I heard today was a recapitulation of yesterday's press conference. And we'll define the word incident, we'll define the word hack. All of a sudden, we're talking ransomware. If it was so serious, 3.5 weeks or 3 weeks after December 4th, you told the leaders of this legislature, you basically misinformed them. You were dishonest. And the governor's staff was there too. And I don't know who was part of this collaboration to misinform or disinform the public and the legislature. But I think there's got to be an accounting. And while we can't bring up perjury, this is not a court of law, I think it's shameful. And to tell you the truth, excuse me, I'll finish in just a second and you'll have your opportunity. Baltimore City was breached with ransomware. Baltimore County Public Schools had a ransomware attack. And then on December 22nd, you didn't mention to the leader of the legislature, but you said unequivocally, it was an incident, it wasn't a hack, and left it there. That's what you told us. And it's dishonest. And I think I and the legislature in toto, one, deserve an apology, and there's got to be some serious reflection upon the administration. Now, if you'd like to answer, I'd be happy to hear it.
Very much appreciate your views and perspective on this, Mr. Chairman. We've laid out the facts as we've seen them. I don't know that there's much more that we can do.
You haven't answered the question as to why you said one thing on December 22nd, and then on January 13th or January 12th, you said something else. I mean, just answer to that question.
I will reiterate that I believe maybe what you heard in that conversation on December 22nd misaligns with what I recall. So I'm more than happy to sit down with you and review the exact presentation in the hopes that that helps clarify for you.
Yeah, okay. Thank you. Let me go to Senator Fry Hester.
Thank you very much, Mr. Chair. I was, I worked with both Do It over the interim as part of this committee to try to understand where we are in cybersecurity. And I was just, with a specific hack, my question is, was this incident preventable? You made it sound, like they're attacking health departments everywhere. But if you could answer some specific questions, it would be helpful. First, does the health department meet DO-IT's minimum cybersecurity standards? Second, what is the baseline training that the Maryland Department of Health staff receive on cybersecurity? Is the department following a zero trust policy? And is the server in question up to date on software patches? Thank you.
I'm just writing that down. So regarding minimum standards, that is something that we're going to have to review when this is all said and done. Part of every event is an investigation, follows with an after-action review to make sure that anything that wasn't followed, where there's a gap, is addressed. Regarding training, every Maryland Health Department employee is required to undergo cybersecurity awareness and training. That training is provided by Do It on a monthly basis and covers a wide array of topics. I'm going to go to the patches question. I'm going to come back to zero trust at the end if that's okay. Regarding patches, that is again something we're going to have to see once the investigation concludes, whether there were issues related to patch deployment that had a material impact on the incident. And then zero trust. So the state of Maryland does not currently have a zero trust policy. The federal government, through an executive order, I believe that came out in late January, early February, and then reiterated in March of last year, did make a push for zero trust. We're currently looking at that, and that'll be a tactical deployment. Regarding the kind of opening, was it preventable? I think with hindsight, every incident is preventable. The question is, would reasonable measures have been put in place to prevent it on the front end? And then how does recovery occur? Does recovery occur in a way that you would expect. So you remember in the survey, we talk about recovery time objective and recovery point objectives. So did system and business function recovery occur during those times? And that, again, is something that through the course of the investigation and the after-action review, we will work to determine.
Okay, let's go to Senator Lamb.
Thank you, Mr. Chairman. I'm going to focus on the health pieces because I share the same frustration that Chairman Pinsky also mentioned, but I think he addressed that thoroughly. My concern is with the ongoing pandemic and the difficulty that certain healthcare workers, specifically ones that need to be licensed and credentialed, are having a difficult time being able to complete their licensing process with various boards of health, with the Department of Health. And that these health occupations registrants can't get their initial applications through the occupational board that they're asking to be licensed for. As you know, we have a shortage of healthcare workers. Many of them are going out with COVID. And I know that the governor had put in place an emergency order that tries to extend the ability of nurses to be able to help with the current pandemic that we're in. But we also recognize that there are other healthcare workers like physicians, social workers, other licensed healthcare providers that are struggling through the initial registration process with their appropriate health occupations board because of the ransomware attack that's occurred and has taken down these systems. Is there any plan for the governor or for the Department of Health to also extend these emergency provisions for other health occupations to be able to function and be fast-tracked through an application process, especially for initial registrants? It sounds like those folks who are already in the system may be able to be relicensed more quickly, but these initial licensees are having a really difficult time being able to get through the system.
There's a couple of questions in there. As far as the Board of Nursing, for example, that was definitely one of our focuses. While they had the ability to, they had some workarounds, we also focused on bringing their system up as a priority. Fortunately, the system is now up and operational. The folks that process licensing can perform their duties on premise, and very shortly they'll be able to perform their duties remotely. And also the website for folks to look up the status of their licenses has been up for a couple weeks.
I think my question was about the other boards.
Yeah, let me try that, Senator. We're taking them one at a time. We understand the urgency. One of the challenges for the health department is we don't have authority over their systems. They connect, and that's something we're talking to the legislature about. We think that's a really critical issue, that the department needs to have more authority to determine the protocols and the connections to the department's network. So each one has its own system. They have their own people, and what they generally just do is tie in. So we're going to be talking to them individually. We have made a recommendation over the last couple of years on a number of occasions to bring the boards into DoIT's one-stop portal, which is up and working and very effective. And as we're having these discussions this week, I've asked DoIT if there's a way to at least start bringing the smaller boards, if they're willing to do it. We could offer solutions, but they have the opportunity to tell us they want to do their own thing.
Okay, well, what you're saying doesn't make sense, because on one hand, you're saying that they have their own system, but then their system is clearly tied to yours, because when your system went down, you dragged theirs down with it. So with all due respect,
not the system.
Doesn't make much sense to me.
Excuse me, Senator, go ahead. The network is ours. The system is theirs. They choose to connect to our network, and we have, on several occasions on the last couple of years, offered to bring them through one-stop portal, which is much safer. but we're still having those conversations, and hopefully we'll. Oh, I'm sorry. Sorry. Anyway, that's all I had, Senator.
Senator,
Okay.
I may mention.
It sounds
one
like a
more
lot of
thing.
finger pointing, but
The one commission we did.
Let's go back to
modernize
the
one-
Chairman Pendergrass.
Okay, I'm going to call on Delegate Kelly first because she is the perfect follow-up to the start of that discussion.
Yes, thank you, Madam
Delegate
Chairman.
Kelly.
Thank you, Madam Chairman. And thank you to Senator Lamb for your questions, because I wanted to have a conversation on that same topic. So I think some of the answers I heard to Senator Lamb's questions were inconsistent with the facts I'm hearing on the ground, particularly as related to the Board of Nursing. What I heard as an answer was they can perform their duties right now at the Board of Nursing. They have a paper workaround that is causing tremendous delays and backlog. And I know my office, as well as many other offices, are really swamped with concerns from nurses. So one of my questions was, from including nurses, but also other health professions, is MDH tracking? Do they have an estimate of how many health practitioners' licenses have been impacted as a result of this incident? We know that the Board of Nursing has a paper workaround, but it is causing tremendous delays. We know that the Board of Social Work right now does not have a workaround, and I have heard numerous complaints from people who need social workers. I spoke with my own hospital, Suburban Hospital, a couple of days ago. They have a tremendous shortage of social workers. We cannot afford for this to be happening. So my second question, and follow up to how many health professionals' licenses have been held up, my second question would be, what resources do you guys need in order to support these boards as they dig out of the impact of this attack? You guys have a codependent relationship in many ways. Although we can say the boards are independent, clearly they are quasi-independent in many ways, and they are dependent on your system. And this attack really caused a tremendous burden for them. I heard someone earlier say that many essential and core functions have not been impacted, but I would argue that licensing during a pandemic is absolutely an essential function. So we need to work together collaboratively to figure out how to do that. So first question is, how many health professionals are we talking about? Number two, what resources do we need to do you guys need in order to help fix this in a collaborative way? And then the third is particularly related to those folks who had their license information in before December 4th. How long do we think it's going to take for that data to come back? I've heard they don't have access to that data right now. Do we think that they ever will? One of the estimates I have heard from one of the boards, the Board of Nursing, is that they think it probably will take about 3 months for them to dig out from the backlog that's been created by the last 4 or 5 weeks. And one of the requests, following up on Senator Lamb's specific request, was that the order of January 4th be expanded. Right now, the language that's in there, and I did send this to you all via email a couple of days ago, but have not heard a response. There's 2 sections in that order. One suspends the expiration of nursing licenses through February 3rd, and that includes certificate holders. And the Board of Nursing is saying they definitely need more time than that, so that deadline could be pushed out further. And then the second, section 5, which I think is what Senator Lamb was referring to, expands the nursing graduates' ability to work under supervision prior to their initial licensure. That only refers to nursing graduates, and I'm hearing from the nursing board that it would be very helpful if that also included LPNs, CNAs, and other nursing extenders. So again, I sent that question to you guys over email a couple of days ago, haven't heard back. So I hope someone was taking notes on those 4 questions. If not, I'm happy to repeat them for you.
So I'll start. Thank you, Delegate, for your questions. Very important questions. So I can tell you what we're doing is we're taking a look at all, as I indicated in my initial statement, we're looking at prioritizing all our systems. So obviously, the licensing boards, in particular, the clinical licensing boards, are absolutely mission critical to us, especially during a pandemic. So we have prioritized them to mission critical, our tier 1, our highest level, and working very closely with Do It Here to restore those. Now, what we're doing across the board for MDH in general is implementing our continuity of operations plans, and that's exactly what the boards and commissions did. They implemented their COOP plans, which included workarounds. Now, generally speaking, workarounds can be more labor intensive. They can take more time. We're trying to streamline those processes as much as possible, working with the boards and commissions at all MDH administrations to try and streamline all our workarounds as much as possible, while we are prioritizing at the same time on a parallel path restoration of systems at the same time. So running parallel tracks on this, trying to get things up as quickly as possible. In your letter, we'll review it on Tuesday and make sure we get your response to that. We apologize, make sure we have that to you. We don't have a Board of Nursing table, not able to provide the number of renewals. We're working very closely with them on getting those and getting the backlog taken care of as part of this process. But Lance, I don't know if you're going to chime in on the specifics when it comes to the systems being online. I think you mentioned it before, but we're very, very close to having everything online, operational, so we can address the backlog.
Yeah, the system is operational, has been this week, so if you've heard that it wasn't, it might have been old information, I'm not sure. But the licensing system is fully functional. It does require that you're in the office, and we're working as we speak on making sure those folks can also work remotely. And by next week, we should have that. We should have the ability for their staff to work remotely or on-prem.
So if I may follow up, Madam Chair. So I'm hearing you say the licensing systems are operational, but what we're hearing are things like fingerprinting are not able to come back, that maybe technically it's operational, but it's not in practice operational. And I know my office has been getting calls throughout the day, today and yesterday. So I think that it's not accurate that every board has functional licensing systems right now.
I will check. I know I'm not talking about all of the licensing system. I was focusing on Board of Nursing. We are working with the other licensing folks as well. And we just prioritize Board of Nursing at the top of the list, but the other boards are right at the top of the list.
So again, what I'm hearing directly from the Board of Nursing is they do have a paper workaround. It is causing significant delays. There are volunteers in there working from all across the state trying to help them get things processed, but there's a tremendous backlog, and they have asked several days ago for an extension and expansion of the order that the governor issued, because they are waving their hands, begging for help, saying we need more time. We especially, and this is incredibly important for the hospitals and for the long-term care facilities, they need certified nursing assistants, they need LPNs, as well as nursing graduates included in that order. They're telling us what they need, and I think it's our job to hear. So I think my final follow-up question is just to the Secretary. I know you and I have talked about the unique relationship between the boards and the department, and I agree with you that we need to really look at sort of the systems of accountability and cooperative working together in the future. We're in this situation right now today, and I'm very much hoping to hear from you that there is going to be a system in place that is supporting all of these boards as they deal with the impact from this attack on your IT systems, because it has created a tremendous burden for them. And we can't just, at the Department of Health, you can't just hold your hands up and say they're independent, sorry. And that's what I'm seeing happening, which is not the right situation. So my question is, are you committing to collaboratively working with them to telling us what resources you need to support them through this, and acknowledging what they're telling us is it's going to take several months to dig out from this, and they need help.
Absolutely. We have resources that are dedicated every day. Deputy Secretary Chowdhury's full-time job is focusing on that, and Deputy Secretary Shine is also committed to that, and they're at the top of the list for restoration. So no question about that.
I think the issue isn't restoration so much as helping them dig out. Once the systems are restored, they have a tremendous backlog. Doing a paper process slows things down tremendously. I'm
going to stop things here. I'm going to interject. I'm going to suggest to the Secretary that he say to all of these licensing boards what I say to my subcommittee chairs and my members. Please tell me what I need to hear, not what I want to hear. I think that summarizes what you're trying to say. I don't think we can ask a question that will actually get us an answer that will be useful today. I think what we maybe can do is suggest that they move forward by listening to the people who are having the problem and trying to find resources to help them solve the problem, which I think is what you're trying to get to. So with that, I'm going to turn it over to Delegate Lewis Young.
Thank you, Madam Chair. Thank you for your comments and update today. I believe my question follows on the line of inquiry that we just heard from Senator Fry Hester. What type of backups are taken of the servers? Are they file backups? Are they image backups, or both? And what is the frequency that those backups occur?
So I'll go ahead and answer this one. So thank you for the question. The number of servers we're talking about is extraordinary. So I don't know that I can give you a whole cloth answer. You're probably talking about over 1,000 servers, which use it, and it's just unfortunately, it's a big number. You're talking about a mix of file system backups, of snapshots, of all of the different technologies involved. So I would be hesitant to give you a broad answer. There's also likely not tremendous value in sharing that when contrasted with the risk of speaking to the backup strategy of any particular system. I'm trying to figure out how to give you an answer that would help here, and I'm kind of struggling a little bit.
Okay, I'm trying to ask a question that's standard operating procedure, not just about this investigation.
Okay. So in general, I can say that the systems use a mix of file level, snapshot based, and whole disk, using everything from full backup, differential backups, and incremental backups. And that's what we've seen across the totality of the environment.
Thank you.
Delegate Resnick, you're next.
Thank you, Madam Chair. I want to start off by saying I appreciate all the hard work that's going into trying to restore all these systems. I know it's not easy. I think we all know it's not easy. The best way we can get through it is through a collaborative process. We work together. I want to come back to the issue of the boards from a slightly different perspective as well. My office is getting the same concerns from nurses and other licensees as early as 2 days ago, emails that they were not able to get licenses and that they would potentially lose their jobs if the licenses are not restored, or for new employees, if contingent on license being acquired. So two questions: to what extent are you working with employers to let them know and working with them to make sure that licenses being processed on paper, or that whatever delays is not going to cost people their jobs? The second question I have was regard to the system integration. 2 sessions ago, I had discussions with the Department of Health about integrating the board systems more fully with the department. And I was told that we would look into it, and that if you needed a legislative solution, that you would get back to me. And 2 sessions later, so that's a year and a half later, I just heard the secretary say that we are looking into a legislative solution. So once again, we are in a situation where we are running remotely and not thinking proactively about an issue we knew was a problem 2 years ago. So first question, what are you doing with employers to keep folks from being terminated or not hired as a result of this backlog? And 2, why did we wait 2 years to solve a problem we knew about?
So on the employee, let me take the employer issue first. We are talking to the employers. We're working with the hospitals and the nursing homes, and the current order, which has the 30-day emergency, does allow us to extend licenses. We are evaluating through the month how difficult it's going to be, and there is a part of statute that allows all licenses to not expire if you apply 2 weeks before expiration and the board takes no action. So there's a number of ways we can do it, but the bottom line is we don't want licenses to expire, and we'll be taking action. Regarding the sessions, we've been working with DoIT on getting a major IT project for the Board of Nursing. For One Stop Portal, we had hoped that would move faster. That was going to be the prototype, and it just hasn't moved fast enough. And so now we realize after, that experience that we're probably going to have to do something more aggressive. But we wanted to try to work in a collaborative way and see if that process would work, because we didn't want to jump to a legislative conclusion, but it's clear that something different is going to have to happen. So I'd be glad to work with you on that going forward.
Okay, I'm going to call on Delegate Hill next.
Thank you, Madam Chair, and thank you, gentlemen. This is challenging stuff. I appreciate that. I want to go back to 9/4, and I understand statistically that about 70% of times when folks are affected by ransomware, they're also, affected, they're actually infected. And you've made this distinction that there was no breach, there was ransomware, but there was or wasn't. So, and I don't want to delve into that, but what I do want to know, you said the morning of September 4th, some abnormalities were noted. So you didn't say that we were given a ransom demand. And a short time later, the cybersecurity response plan was activated. What I'm missing is how long was this outside group walking around in our network before the abnormality was noted, since apparently there was no demand. So do you have any information on what the time lapse was between when access was gained and when we noted that there was a problem? Was it days, hours, minutes?
So thank you for the question. It's a great question. And again, and I hate to have to repeat this, but this is something that still has tremendous investigative value with regard to an ongoing criminal investigation. So unfortunately, we can't share any information about when we believe initial access occurred to the network and the time lapse between initial access and deployment of any payloads.
Okay, and you can't give a range, whether we're talking hours, days, weeks, or longer?
Unfortunately, I cannot.
All right, thank you.
Delegate Rosenberg.
Thank you, Madam Chair. One of the witnesses, I forget who it was, said that
Please get closer to your mic.
Sorry, said that this hack did not affect core functions of the department. I mean, there have been reports of, even now, people who can't access treatment for HIV, that you have not been able to issue death certificates, and there's a lack of work computers. How do you define core functions of the department?
Could you repeat? We didn't hear the whole question.
I'm sorry. I forget who it was, but one of the four of you said that this incident, this hack, quote, did not affect the core functions of the department. Okay, I think you had the same speechwriter as the person who said this was an incident until you acknowledged that it was a hack. There have been reports that people, were not or still are not able to issue death certificates, that people with HIV were not able to get their medications, and that there's a lack of state computers for people to do basic functions. So my question is, how do you define core functions?
Yeah. Thank you for the question. So core, what we did is we took a comprehensive look at all the business functions that were affected by the incident, by the security incident, by the attack. and we categorize them by tiers. I mean, generally speaking, there are some mission critical and life safety functions that would be sort of categorized in tier 1. And there's 3 additional tiers that would go progressively down regarding their level of priority, given our standards. But there are numerous core functions that are mainly in tier 1 that we go through. As we go through everything, we are focusing primarily on licensing and other avenues to get these operations back on board. But as we prioritize these things, it's important to note that we're working diligently on the workarounds. So again, we're running parallel tracks on the comprehensive workarounds in order to get them operational in accordance with their COOP plans, their continuity of operations plans. Business functions, business units, boards and commissions, the healthcare system, we all have plans in place for these types of incidents. So that can be implemented as well as modernized and adjusted as needed. So we're updating our COOP plans and implementing them to implement our workarounds to become functional and operational. At the same time, we're building restoration capability through our coordination with DO IT to recover and restore our systems. So a lot of our functionality we are continuing to perform for the citizens of the state in order to provide services. And again, workarounds may be a little more labor intensive, may take a little more time, but we're able to provide the core functions of the department. And as we bring systems online, that may take a little time, but we'll transition over. It's important to note we're also taking a look at our current workarounds. Do we need to implement more, invest more time, energy, and resources to make them more comprehensive in order to provide more services and or make them last longer? So we're providing a lot of resources to our business units in order to implement these workarounds and become more functional and operational. And then to your questions about computers, we have already, we have about 5,400 computers that we've purchased. We've also purchased Wi-Fi devices. We have already purchased various printers and other things to make sure our business units and employers are able to function and able to provide services. We also set up a hoteling space here at our headquarters building in Baltimore to provide a hoteling space for people to work and come and work in a clean, safe environment. And we'll be happy to provide more information to you. We do provide FAQs to all our employees, and we're constantly in communication with our employees weekly and daily that we provide updates to them throughout this process so that they're well informed. And your question regarding death certificates, that functionality was restored on December the 18th. And I believe you had one more question regarding the Maryland AIDS Drug Assistance Program, or also known as MADAP. We have implemented workarounds there at the program. So existing and returning participants of the program can continue to receive services. We're continuing to pay insurance payments for participants, insurance carriers, et cetera, in order for them to receive their medications. New applicants, and we get very few new applicants in weekly. It's probably only a handful in that we get weekly. Monthly. We only get a handful of new participants in monthly, but we are working with our partners. We are not the only providers that provide these types of services. We're working very, very closely with our providers in order to provide these types of services to any new applicants. And these are community-based providers, 330 clinics and FQHCs, the Ryan White Part A and Part B subrecipients programs, and the gist of it here is no one is going without their medications through the MADAP program due to this network incident.
Thank you. Let's go to Vice Chair Kagan, please.
Thank you, Mr. Chair. I spoke to our wonderful state auditor, Greg Hook, because I know that there were several audits that were being done. And I wonder, so I totally understand that life-saving, that everything is triage and that life-saving work has to be prioritized. But one of the realities is that our responsibility is making sure the government is running correctly and that our taxpayer monies are being spent properly and the programs are working. My understanding from Mr. Hook was that there were 3 audits that were affected by this, by the hack. One is the Office of the Secretary itself, which was suspended. One was on medical care, on Medicaid, and one was behavioral health, and both of them were delayed. One of the problems with those audits going forward was the lack of access to data. So I don't think it will be compromising for you all to just give some indication of what communications, what plans you have with the Office of Legislative Audits, so we can be assured that oversight is going to continue of your work. And thank you for your engagement on these issues.
Yeah, thank you, Senator. I'll handle that question. We have a tremendous working relationship with the auditors at OLA, and work with them very, very closely and respect the work they do, and it's important to us. They determined, they came back to us after we assessed where we were and determined that they're going to continue and finish up the audits on Developmental Disabilities Administration. But this year they combined the Behavioral Health Administration and the Medicaid Behavioral Health. So, we can get access to some of the data, but I believe they wanted to wait. And but I want to move that as quickly as possible because those audits are important. So we're talking to OLA about this, and they have actually done us a great service over the years in helping us identify. We've actually established an internal controls and audit compliance group in the department to have a better outcome from these audits. So I will make sure I'm aware of the decision they made, but I do want to move quickly to get them back in.
So, Mr. Secretary, thank you for that answer, but there were 3 audits. You spoke to 2 of them, and the other one was of your office, specifically the Office of the Secretary, and I wonder what your plans are for that.
Well, the same thing with that. I want to get that in because actually we've had major progress in the Office of the Secretary since the last audit. So I was looking forward to that one to show all the things that we had done. So I want to get them back in as soon as possible.
Okay, I would love to continue to get updates on that if you would. And I'm sure
Thank you.
Senator Lamb, who chairs that committee, would also like to be in the loop. Thank you, Mr.
Thank you. We'll go to Senator Fry Hester and then turn it back to the House members and Chair Pendergrass.
Thank you very much, Mr. Chair. I'm limiting myself to 2 questions. The first is that we originally heard that no data had been compromised or exfiltrated. However, in the most recent statement, that wasn't repeated. So my first question is, what assurances do we have that the data from the Maryland Department of Health was not removed and now in the custody of the attacker? That's my first question. My second question is, I just heard that we've now purchased 5,400 new computers, and I think there's about 8,000, that are needed to cover all the employees. And so my question about these computers is, are we purchasing them? Are we leasing them? Did we look at a device as a service strategy? And is the Maryland Department of Health doing this? Do it or the Department of Budget and Management? Because there's costs associated with these. And if you're doing a big purchase like this in a short time frame, it's going to be more expensive than moving to something like a device as a services strategy, where likely in the long run, the contractor owns those computers. And if this happens again, which I hope it doesn't, the contractor would be just responsible for re-imaging those computers. So those are my 2 questions. Thank you.
Thank you for the question, Senator. I'll cover the first question regarding the, I'll restate what I said earlier. To this point in our investigation, we found no evidence of access to or exfiltration of any state data. So through the forensic process, what we work to do is identify the mechanism of initial access and then identify each piece along the way where there was some human-computer interaction by the adversary or adversaries. So as we touched each of those systems in the forensic investigation, one of the things we look for is, were they doing anything that would indicate that they were accessing things or removing things or staging things, or were their activities focused exclusively on deployment of ransomware? In this case, to this point in the investigation, the only activity we've identified is activity indicative of deployment of ransomware. There's been no indication that there was attempts to access or exfiltrate any data. And that's a much wordier explanation of what I said. Does that answer your question?
Yes, it does.
Okay. I will pass it over to Atif.
Yeah. Thanks, Chip.
For the computer question.
Thank you, Senator. Great question. So the laptops that we have ordered have been a combination of both purchase and lease. And we're actually working that into our refresh schedule for our current inventory of PCs and laptops. So we're actually accelerating our refresh schedule as part of this process, and also looking into all options. We're actually weighing options versus the device for a service, device as a service versus purchase. What's the most cost-effective to the state? And we're exploring all options.
Thank you.
You're muted, Madam Chair.
Yeah, that space bar was working for a while. It was pretty great, but apparently it's not working to unmute anymore. Delegate Bandera, you're up next, please. Are you there, Delegate Bandera?
Yeah, I'm sorry.
Okay.
Thank you, Madam Chair. It has been almost 41 days since the service disruption on December 4. I understand ongoing investigation occurring on a parallel track to restoration effort. And as you said, presentation that we cannot speak to the motive or motives of the threat actor because since you guys have been doing the full forensic investigation report, in your briefing, it was mentioned that no evidence that this incident resulted in unauthorized access or acquisition of any data. Without full investigation, how can we conclude that no data was compromised? What measure have you put in place to bolster our IT system to prevent such future attack? Did hackers ask for any demands since you said that no demands were paid? I wonder that is why it took a long time to restore the functionality of the critical service, such as restoring the death certificate.
So I'm sorry, thank you for I think there were 3 questions, so thank you for those, Delegate. The first question was how sure are we and how can we be so sure? The third question, I believe, was any context, but I didn't write down your second question quickly enough. Could you repeat what that was?
Yeah, without full investigation, how we can conclude that no data was compromised? And what measure have you put in place to bolster our IT system to prevent such a future attack? And did hackers ask for any demands since you said that no demands were paid? And I wonder that is why it took a long time to restore the functionality of the critical service, such as restoring the death certificate.
So, okay, I think I have the questions. If I left any out, please let me know when I conclude. So the question, how can we be sure? What evidence do we have? So when I give kind of a detailed briefing about this, I talk about evidence of absence versus absence of evidence. So what we are having to do is collect a bunch of evidence to prove a negative. As I described in response to Senator Hester's question, what that means is going system to system to identify any evidence of what the adversary did while they were in that would indicate that. So in answer to your question, how sure? The answer is we don't have certainty until we conclude our investigation. But to this point in the investigation, we've identified no evidence of that. So I hope it doesn't sound, because I think it may have caused confusion elsewhere. hopefully that's clear that this is ongoing. We're looking for that evidence, and we have not found any to this point. Regarding measures to bolster, I think this is one where we don't want to speak to any specifics, especially in the midst of activities to reconstitute services. But we are working diligently to identify, through the course of the investigation, any system-level weaknesses, either administrative or technical, that contributed to ensure that through the course of recovery, we don't leave any gaps in the network. And then the last question, I think it was kind of two questions in one, but I'll combine the response, which is, any follow-on demands, I think was your question, which is, would indicate that perhaps I mentioned the unsuccessful distributed denial of a service attack that occurred. So typically those come with a, we did A, now if you don't pay, we're going to continue to do B, which is the denial of service. And this is why, we don't have reason to believe at this point that those two are connected, because that attack came without any contact or demand. Did I answer all of your questions?
Thank you.
Okay, great. Yep.
Delegate Krebs.
Well, thank you, Madam Chair, and it's been very interesting. And Secretary Schrader, first I want to thank you for acknowledging the backlog of IT investment for many, many, many years. I've been hearing about this since I first came here almost 20 years ago with the Chessie system. So I'm glad to see that we have a lot of investment in IT projects going on and that we're trying to do some central oversight. But I want to speak specifically about the Health Occupations Board, which many of us has been concerned with. About 3 or 4 years, I've been working on this myself, having a common platform for the Health Occupation Board. And unfortunately, it got derailed a little bit, the bill, because of COVID. But we did pass the bill last year, the Senate and the House, and I think we didn't realize how important it was going to be when it got passed. And you guys were going to come up with a report this year telling us how do we get to have one common IT platform for all our Health Occupations Board that would be protected and secure. And so I think right now, you mentioned a couple of, we haven't seen the report yet. I think that was due December 31st, and I'm sure you guys were working on it, but hopefully that report will contain some of the issues that have come up today. One issue was no authority over the systems of the boards, the health occupation boards, that you don't have the authority, but yet I think our bill basically said we're going to have a common IT platform. And you also back then had said that you had this one-stop portal that was a prototype, and this is going on a couple of years ago with the Board of Nursing. So I'm interested to know how that is moving along, because that was the prototype for everyone else. So it seems to me we have an opportunity now to accelerate this common IT platform for Health Occupations Board that we've all sort of given our blessing to. The Senate and the House passed the bill. So the question I have for you is, what else do we need to do? I know the report is coming, and hopefully some additional information will be in that report of action items for us. But what else do we need to do to accelerate the operational common IT platform for all Health Occupations Board? And will all of this be included in the report that is due to this committee so that we can act on that during this session, so we don't keep being delayed? Because we started having this conversation 3 or 4 years ago, and it really wasn't as important as it is now. So the urgency, I think, is here now, especially for our licensing boards. So, the question is, what else do we need to do? Will it be in the report? Is that ongoing? And when will that be available to our committees?
Thank you, Delegate. I share your sense of urgency. I think the time is now. I would first ask Deputy Secretary Shine, who's been working on this project, to get his take and any advice. And we'll be advancing the report. As you said, we've been a little distracted, but we owe you the report, and we will get it to you because this is an important issue. So, Secretary Shine.
Thank you for the question. Just the report has been done. I know that I've seen the final draft. It's being submitted to some of the internal folks at MDH right now, so I'm sure it's soon to be in your hands. Also, we have been working with the Board of Nursing, but with COVID occurring, they kept asking if we could delay because they were so busy and overwhelmed with the COVID response. So we've been catering to their schedule, but in light of what just happened, I think everybody is in the mindset that we need to move this along as quickly as possible, and we'll definitely work with you to make that happen.
All right, well, thank you. Just let us know if you need additional authority. We need to reach out to the boards, and we want to make this something that they want to participate in for all of the reasons of protection of this data and the modernization and consolidation of these IT systems. So we look forward to that. And if there's anything we can do in our committee and in the Senate, I'm sure we would like to help accelerate that. Thank you.
Delegate Penny
Thank you.
Melnick.
Thank you, Chairman, and good afternoon. So I have a simple question. Would the department, will you please tell us today, will you consider extending all health professions, licenses, and permits used by the state that are so important today, given that we have a shortage and that some have chosen not to even renew, that they're leaving the health profession, that we don't have a pipeline? Will you consider extending the licenses and permits that are going to be expiring soon, extended until at least August, to give all these commissions time to fix their program? It's a simple yes or no, and it will take care of it immediately.
So, well, let me try. The bottom line is that, and we want to extend as long as we can. The existing law, the way we understand it, already allows licenses not to expire. And we have asked what our authorities are within the department to make those decisions. And we've been advised by our AG that authority does not rest with the secretary in statute.
So may I, Madam Chairman?
Yes.
Okay, so if it doesn't rest with you, do we need a bill that we could do an emergency bill this week, draft it, where it will give you the authority so that we can put this to rest and give people peace? We got an email from a woman that waited 2 days ago and freezing, the weather was horrible, an hour at the office, and they said it would be hours, and there was a line at the Board of Nursing before she could be seen, and this applies to many others. Do you need us to put in a bill, Mr. Secretary, so that you can have the authority and we can get this done, extended at least, until August or whatever time you need, just to give people a breather?
I thank you for any help you can give. That would be appreciated.
All right, we will look into it. I have a follow-up, Madam Chairman, may I?
Yep.
So we know, going back to do it, we know that this happened. What will you do in the future? And tell me if there's anything you have in the works to evaluate every single department in the state of Maryland. Because we should. If it happened to the health department, it will happen to the environmental department, it will happen to the agriculture department, to the education department, you name it. What can we, and we all are offering to help, do while we're in session, all right, to allow you to do an evaluation of every single department so it doesn't happen and you get outside professional help if we do not have it within?
So I'll go ahead and take that question, and I thank you for the question. One of the activities we have underway right now is cybersecurity assessments at the agency level to review the security posture of each of the agencies, including penetration testing to identify weaknesses in their external boundaries that they control, and any system level weaknesses that we can identify. So that's an ongoing activity that was started with the creation of my position in 2019. And obviously we've had a couple of starts and stops as a result of COVID, but that is underway at a good pace now. So I expect that those results will help drive our security posture forward. I do want to just add on one note there, which is that there's no silver bullet when it comes to cybersecurity. So I think that one of the things that, sorry, I got some feedback there. One of the things that we have to consider here is that adverse cyber events will always happen. So what really becomes important is our ability to quickly detect, respond, and recover. And part of what my office has done over the past 2 years has created a tremendous emphasis on that incident response so that when things happen, we're able to respond and recover quickly, especially for the agencies that are fully supported by the Department of IT.
Thank you. And if I may just say, Madam Chairman, I am going to ask my wonderful colleague, Delegate Kelly, since occupational licenses she is the chair of that department, of that committee, excuse me, can you ask for that emergency bill? You could lead it. Thank you.
Thank you, Delegate Pena-Melnick. I'm actually going to suggest to the secretary that he do the thing that I suggested that he do to his people by asking what he needs to hear, not what he wants to hear. But at this point, that he needs to go to the governor and say, this is what we need to do, and we need to do it now as an emergency order, executive order, to get it done so people have the security to know that they're not going to get fired. In the meanwhile, if you need a bill, we're happy to do that and put it in and get it done as quickly as we can. But right now, I think what you need to do is tell the governor what he doesn't want to hear, which is, we got a problem, we need to fix it, and you have the authority to fix it. So with that, I'm going to turn, because it was not a question, to Delegate Young.
Thank you, Madam Chair. Thank you, members of the committee, and also for the words from the department. So this was just touched on a minute ago. My question was going to be, it was 2 parts. What was the capability of DoIT to conduct a comprehensive review of cybersecurity needs, vulnerabilities from individual departments? And I believe that you just mentioned that something like that is going on. Is that correct?
That is correct. In addition, Department of Health recently subscribed to the Department of IT's vulnerability management service. An application that gets installed across the environment to detect vulnerabilities and help them to prioritize remediation. That was a statement of work that occurred in 2021 between the agencies and was underway with deployment by Department of Health resources.
Great. And I know from the conversation, I think that there's, well, and we've been dealing with this too through our hearings over the last 9 months. There is a disconnect between the authority of one agency over another, or at least do it to dictate or to find. So I guess what I'm asking is, if a threat is found, if you've identified a threat through an agency or one's determined because it's their own internal review, what authority do you have to mandate or require them to make a change? Or do they have to then choose to do it on their own if they want to, or if they feel they have the funds or capabilities to do so?
So the executive order that created my position in 2019 gives me a few authorities. One of those authorities is to effectively disconnect, by order, any systems that don't meet minimum standards or that we feel present an unacceptable risk to the state. So I think that's the main authority that would cover the sort of scenario I think you're asking about.
Yeah, and that's good to know. It's just I understand, and you just mentioned it too. I think you said respond, react, and recover, because these things are going to happen. All right, and I understand. Go ahead.
Detect, respond, recover.
Yes, thanks. Detect, respond, recover. And that doesn't get us off the hook for being prepared or being proactive. And I'm not saying that that's what you're saying. I'm all about learning from our mistakes, not when they cost tens of millions of dollars to figure them out. Or like putting kids, 115 kids that can't access their computers or get their education that's mandated that we're supposed to provide as a government. I'm just saying that with that mindset, if you went in and you did a review of the Department of Health prior to this happening and identified, and I know I'm looking forward, I'm charged with anticipation of the after action report you guys are going to provide us. But if you had found something that would have been a vulnerability, and maybe it comes out that that's the reason that this happened, you would have been able to come in and say that you need to turn that system off and cut it off, and nobody would have been able to then say no to you.
So I think that there are nuances to questions like that.
You're right. You're
and
right.
I just want to be very, very careful when I answer that, because I don't want to give an answer that would mislead. So my authorities allow me to demand the disconnection of any system from the state's network. So I think this is something that we've reviewed before, where if they were connected in Amazon, for example, my authority doesn't extend to Amazon Web Services, things like that.
Sure. So if an agency was using Google, then you wouldn't have the authority to then have them.
If they were hosting some application in the Google Cloud platform, that would be outside of the authority of my office.
Looking forward to the continued conversation about centralizing and making sure that we can have the authority to do what needs to be done to protect our data and information. Thank you.
Absolutely. Thank you.
Delegate Saab.
Thank you, Madam Chairman, and thank you, Mr. Secretary, for answering a lot of questions. I don't envy any of your positions. I'm sure it's a lot of work, and while we appreciate everything you do, I still, and I know I appreciate the fact that you can answer some of the questions due to the ongoing investigation as far as how long did it take before the breach or the malware was detected. And obviously you cannot guarantee that the 100% that there hasn't been any data that was compromised, stolen, or lost. And my question is, since we can't guarantee 100%, but is there a way to let people know that there is a potential leak of their personal data, and how to prevent it or how to protect themselves that there is a leak? Because I'm sure there was a lot of people that are affected by this. If in fact it happens to be bigger than we think, we're hoping that it's not. Is there any plan to let those people know that there has been a potential data breach and how to protect themselves?
So thank you for the question, and I appreciate the differentiation between breach and incident, because I think it's a very important distinction in this circumstance. So as you described, we've had an incident to this point. The Department of Health has information about a number of people, personal information and private health information about a number of people. So we don't want to share that anything happened unnecessarily. So part of our evaluation as we go system to system is looking for anything that would indicate the unauthorized access to or exfiltration or acquisition of any sensitive data. At that point, I think then we get into a conversation about our legal obligations and duties to notify. Beyond what is legally obligated, we may say that, hey, there's some circumstance where even though there's not an obligation, it's the right thing to do. So when we come upon a circumstance like that, or if we come upon a circumstance like that, I think that would be the trigger for any level of notification.
So would it be too late by then for them to do anything? Instead, would it be, I guess what I'm trying to say is it to everybody's benefit to be proactive than reactive? I mean, we know it happened, or some could have potentially happened. And I know you're saying you're not legally obligated and it's the right thing to do, but would it be too late by then? It's been already 6 weeks, close to it.
Yeah, I think that would be a speculative, and we're not required to provide notice unless we find any evidence of the unauthorized access or exfiltration. That's why we use that as our trigger for the notification.
Okay, thank you, Madam Chairman.
You're welcome, and we'll now move on to Delegate Sandy Bartlett.
Thank you, Madam Chair. My question relates to transparency. On the MDH website, it is stated that due to the overwhelming request for death certificates, the processing, and this is not the quote, that was the quote, the processing times have been temporarily increased. Secretary Schrader, I was happy when you said that the 2021 death certificates were completed with the help of MD Think, but given what Deputy Secretary Chaudhry stated, that there was a problem with the death certificates and program, and that it was restored. It went down on December 4th and restored on December 18th is what I believe he said. My question to Secretary Schrader and perhaps to Deputy Secretary Chaudhry, will you be transparent to the public to update the website accordingly and state that it is actually due to perhaps the overwhelming request for death certificates, given that we're in a pandemic, but it's also due to the fact that there was an incident? That's my question. I have one other follow-up since I got that delayed time there, Madam Chair, if I can just stick that in there really quickly. And in doing so, this kind of piggybacks on what Delegate Saab's question was. And in doing so, should you discover there has been a data breach, when will the public know?
So on your, I'm going to defer the second question to Chip. But on the first question, I need to go back and take your question and look at the website to understand, what you're asking. And if we find that it makes sense, we'll make an update. But I've got to do some homework before I just commit to that. So, but thank you for bringing our attention to that.
Sure, thank you. And when could I expect that type of update of information?
I'll tell you what, we will call you in the next several days to at least get connected, and then we'll keep you informed rather than setting a date certain, because it may, we may have some homework to do. It may take some time, but we'll connect with you in the next few days as soon as this hearing's over.
Thank you.
And then I'll defer to Chip.
So regarding any sort of breach notice, if a breach were discovered, and again, I think that it's a big if, and I'm, as always, optimistic here. But if a breach were discovered, there's two kind of competing timelines that are our maximum runways. So the first is HIPAA, which I believe has a 60-day from the date of discovery requirement. So we would have 60 days from the date that we identified that a breach had occurred before we'd be required to notify. Now, in those circumstances, the goal is not to hit day 60. The goal is to get it out as quickly as practical. And then the same is true of the state government code, which has a reporting requirement in the event of a cybersecurity incident where data was exfiltrated. There's no timeline on that one, but again, it's in the interest of transparency that we would make that report as quickly as reasonable and practical. And factors like data set size and things like that would impact those timelines.
Thank you.
Absolutely. Thank you.
The last delegate question will be Jessica Feldmark, and then we'll turn this back over to Senator.
Thank you, Madam Chairman. Thank you for your time today. I have a few questions that are really requests for additional information, some follow-up information that I hope you'll provide. This is incredibly frustrating with the lack of information and clarity. And I understand that some of that is due to limitations around the ongoing investigation. But so my first request is, in terms of your opening statements and remarks, which you had indicated would cover a number of the questions that Chairman Pendergrass provided ahead of time. Each of you appeared to be reading as you gave those remarks. So I just wanted to ask if you would please send us those opening statements. That would be really helpful to have that in writing.
Absolutely.
Thank you. My second request is dealing with the confusion sometimes about what's fixed when there's a workaround and what's fixed when the system is actually restored, right? And these sort of parallel tracks, and I understand that the challenges of working on both of those parallel tracks. But what I would like to have is a full listing of each function, service, system that was impacted by this incident, the status of the workaround solution, and the status of the restoration solution, and timelines for each of those. And then the final piece, and hopefully you can discuss this a little bit now, but I'd also like you to, again, going back to the questions that Chairman Pendergrass provided, to go through those questions and answer the ones you can. And then for the ones you can't, I understand there's a valid concern around an ongoing investigation. But what's not clear to me is which are questions that you can't answer right now because the investigation is still ongoing, and which are questions that you're saying you're simply not going to answer for us. I think that's an important distinction, and would like to have that.
And I appreciate that. And I'll mention that there's, I think, a third component there, which are details that by sharing them publicly could compromise the security of the overall system. So, for example, mentioning a particular vendor or solution may create an opportunity for someone to know, hey, this is a way to snake around this particular product or solution. So that's another component that I think we will likely not speak to in great detail, especially publicly.
I appreciate Delegate Feldmark requesting that, because I am disappointed that you didn't give us a written response. It's clear that there will be things you can't answer and things that you can. And I think that it is appropriate to say, answer, and then, sorry, not at this time, so that we see what you've answered, how you've answered it, and what you're unable to answer, so we can go back in future when the time is right and hope to understand more of what's going on. No one wants to put the state or the department in danger. This is not the plan. The plan is to do the best that we can working together. So I really appreciate that you're going to take this approach, and that we will get something in writing after this briefing. With that, I'm going to
Mr. Seahawk, thank you.
Delegate Saab, mute your computer. Delegate Saab, mute your computer.
We're going
with that, I'm going to turn it over.
We're going to go to the final two questions. Senator Ellis, followed by the final brief question from Senator Frey-Hester.
Yeah, thank you, Mr. Chairman. So I have a couple questions for DeWitt. So is it possible to build robust systems that be, how should I say, immune to these attacks, or whatever way you want to characterize it?
I think that you can build systems that are robust and resilient. But I think immunity is a term where, if that were a possibility, everyone would have that. And if you have any ideas about things we could do to increase our outer surface security, I'm always excited to talk to folks about that.
Okay, yeah, thanks for that. I remember a couple of years ago, your department, Department of Information Technology, DeWitt, came before us with a bill to kind of enhance the systems throughout the state. And what happened to that bill?
I'm not sure which bill you're referring to. If you'd like, we can certainly discuss offline and try to figure out which one it is. And
well, yeah, it was a big bill for us, all state agencies to spend turn out to be significant sums to upgrade their systems to prevent any kind of attacks. And I know a lot of state agencies, executive departments lobbied hard against that bill and to get exempted from it. And it was kind of watered down.
I think there was a bill for, and it was, I believe it was before I was here, which is why I'm kind of struggling to make sure we're talking about the same thing. I believe it was the state CIO bill, probably in 2019.
It may have been Senator Jennings' bill, but we can continue this one and get details and information.
So I'm just concerned and that there are several bills, but I know the different agencies lobbied hard against that bill, your bill, to really beef up our computer systems in Maryland. And because of that, I think we are at a disadvantage when it comes to having robust systems, whether it's Department of Health down to the University of Maryland, because these bills will cost money. And there are a lot of, how should I say, a lot of opposition to doing what's necessary because of the cost. And so we need to look at that, I strongly believe, to really address if we as a state need to spend the money to create robust systems to withstand these intrusions, because we know that it will not end. And so the opposition I saw from executive level departments to a bill coming from another department in charge of computer systems was astounding. And so we need to really look at that to see what we need to do to really bite the bucket, spend the money to create strong, efficient systems in order to be as resilient as possible.
Right. Isn't that so?
I'll be more than happy to follow up with your staff.
Thank you.
Thanks.
Final brief question, Senator Fry Hester. We tried to hit 3:30. It's 3:32. Be the final question. Senator Fry Hester.
Thank you very much, Mr. Chair. I'm honored to have the final question. We've worked really hard over the interim to answer a bunch of questions. And, I think that the answers are in the forthcoming report, from the Maryland Cybersecurity Council. And we talk about centralization and modernization. And today I heard two things. I heard our state CISO say that he has the authority to pull somebody off the network if they're not in compliance. I also heard him not be able to answer the question about whether the Maryland Department of Health was in compliance. And so what authority without the knowledge and oversight to know when to use it? It seems like we're in a very difficult position if that happens. And so my request on behalf of my co-chair, Pat Young, and the Joint Committee on Cybersecurity, IT, and Biotechnology is that you continue to work with us and answer some very critical questions. And one which I have asked and will ask again is how many of the cybersecurity assessments are done? How much is it costing? And what do you need to finish them all by the end of the year? I've asked that several times and it's not been answered. And I've got about 10 other questions that haven't been answered also. And I know it's not the CISO's fault he can't answer those questions. But if we don't have a working relationship with the agencies, it's impossible for us to have a legislative solution. And I've also heard the agencies say that they're working on a legislative solution, but which legislators are they talking to? So I've got a couple questions I mentioned, and just if you could really truly answer the questions coming from this hearing, that would be lovely.
Thank you, Senator.
Okay, that brings us to the conclusion. We're only 4 minutes past time. I want to thank Chair Pendergrass and HGO and the members of EPG. I want to thank the people for coming to testify from DoIT and the department. While not satisfied, there are a lot of questions you need to respond to coming out of this hearing and from the initial memo from Chair Pendergrass. So we're all looking forward to the answers to those questions and follow up. Thank you. This brings this briefing to a close.